Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, our kidneys, each the size of a computer mouse, do a lot of work in the body, including removing waste, toxins and excess fluid in the body every 30 minutes. And as essential as it is prone to so many diseases, including chronic kidney disease. So what exactly is chronic kidney disease and how does it affect a person's quality of life? Well, we discuss that after this fact of the matter.
Chronic kidney disease describes the gradual loss of kidney function. It has become a serious public health issue both in developing and developed countries, where currently over 1.4 million patients are receiving renal replacement therapy worldwide. If chronic kidney disease is detected early and managed appropriately, the deterioration in kidney function can be slowed or even stopped, and the risk of associated cardiovascular complications reduced.
I was diagnosed with chronic kidney disease on 3rd January 2013. You know, I was expectant. And now I used to have those symptoms, but I used to ignore, thinking they were signs and symptoms of pregnancy. And these were like swelling, and it went on and on until the time I went to visit a certain facility. And when they checked my blood pressures, and they were very high, that's when I was taken to Nakuru PGH for further investigations. After kufanyiwa CS, I went into coma, nikapelekwa ICU. Hapo ICU sasa ndio nikuja kuambiwa the tests were done. And those are the tests that showed my kidneys were failing. Hemodialysis was the best treatment, or rather I would if I was at a position of getting a donor by then, that's when transplant was recommended. 6 months ago I received a kidney from my brother, and now that's why I call myself a warrior. Everything has changed now. I've gone back to normal life. I'm still on medication. Those are the immunosuppressant. Once you fail to take those immunosuppressant, hiyo kidney inaweza fail anytime ukikosa meza hizo dawa. Dialysis was paid by NHIF, but it came later. I was diagnosed on 2013. By then, NHIF was not catering for dialysis, so we used to pay from our pockets. My advice to someone who is ailing from kidney failure is that you take the precautions given by your doctor. Getting a donor, it's a very hard task. So I would tell that person, you just wait upon the Lord. As you can see, my t-shirt is written, speak up, love your kidneys and save life. Kuna watu hujificha na mashida zao, inakuja kujulikana later ikiwa inalipuka. We started with so many people. They died along the way. I made it. I'm here to tell the ones who are coming and the ones who are ahead of me. Kidney failure is not urogi, ni kitu iko. Watu wasiassume. Ukiona tu symptoms hivi, you just do a follow-up and ona daktari, wacha kuona mganga. And kidney failure, it's a silent killer disease. So we should speak up. We need to speak more about this killer disease.
Great. And to understand more about chronic kidney disease, I am joined by Dr. Joyce Bombengi, who is a nephrologist. I said that right?
Yes, you did.
Thank you very much for making time for us. Appreciate it. And you look lovely.
Thank you
for coming by today. And we also have Rodney Ofula, who is a kidney patient. Thank you very much, Rodney, for coming by as well. Today, and of course, in 2019, you were diagnosed with kidney failure. But of course, before we come to your story, Dr. Joyce, chronic kidney disease, because we've heard a lot about kidney disease here and there, but really, what does it mean when we say someone has chronic kidney disease?
In a nutshell, chronic kidney disease is loss of function of the kidney over a period of time, including patients who are born either with one kidney a structural abnormality of the kidney. Maybe, you know, they're supposed to be positioned at the back at a certain position, so you can find one up, one down, or they're attached to each other, or you were born with small kidneys. You know, there are people who are born before their time, so they're born or born with low weight, so they have small kidneys. And then there are genetic conditions. So even if the person still has normal function when you measure the blood, but they have the structural changes, then that is chronic kidney disease. So it's a group of conditions. And this is important to know, because there are people who will tell you that I had kidney failure and then I got better. So that's different. That's acute kidney injury. Okay. Yeah, so you know, with acute kidney injury, you can have an overwhelming infection, malaria. You could have had diarrhea that was really severe and you got dehydrated. So you didn't have enough fluid in your body, so little blood passing through the kidney. And that can be corrected.
So the size is important.
The size is very important. Right. But there's a set size and weight that the kidney has. It's different for men and women, but normally 8 to 12 centimeters is standard. Taller people have bigger kidneys. Right. Smaller people have shorter kidneys. Yes, so when we are evaluating a patient and we think they have chronic kidney disease, that's one of the things that we're going to look at.
Okay, all right. And in the country, how are we doing in terms of the numbers as far as chronic kidney disease is concerned?
According to some of the recent statistics we have, worldwide, we know that about 10% of the population has chronic kidney disease. And in data from the unpublished data from the Kenya Renal Association, we know there are 4 million Kenyans living with chronic kidney disease. And out of those, about 10,000 have chronic kidney disease stage 5. That means the kidney function is quite reduced to the level that they actually need additional assistance to have, you know, the normal functions of the kidney going on.
You are diagnosed with chronic kidney disease. Unaweza tuambia ulijua aje?
Ilianza mguu kufura, wanasema swelling, uso kufura, kuvimba, then unasikia unahema ile kuchoka, then ukikula anything, unafanya nini? Unatapika. Ukikula anything, tena unafanya nini? Unatapika. So hivyo ndo ilijulikana, ndo nikaenda Mbagathi Hospital. After kwenda Mbagathi Hospital, nikaenda for echo. Wakaangalia echo, wakapata I have a problem of kidney disease. Inaitwa figo.
So kabla ya hapo, hata kabla uende hospitali, kulikuwa na instances where unasema hii kufura tu mguu.
Ilikuwa, by the way, nilikuwa ukifura after some time inarudi. So naenda nanunua ma painkillers pale kwa chemist, wanaona meza, inarudi. Then after tena 1 week tena inaanza. Ikafika mahali sasa ikakuwa nimechoka kabisa. Tumbo uchungu tumbo nayo inaguruma. Haigurumi ila kuendesha, ile inauma, ina relax. Yauma tena ya relax. You can't sleep.
Okay, so and hii iliendelea kwa muda gani kabla sasa ukaenda hospitali?
Iliendelea around 1 month.
Wow.
1 month ikakuwa serious kabisa, ndio ikajulikana sasa hapa hapana. I was in Thika. Walikuwa na tibu tu, wanasema ni malaria, it's come like malaria, but wanapima lakini wanaona, wanasema hakuna kitu.
Niko sawa.
Niko sawa, but when I went to, wakaniandikia barua akasema no, sasa huyu kitu itafanyika, afanye nini? Aende Mama Lucy Hospital or aende any government iko Kenyatta or Mbagathi.
Okay.
So when I went to Mbagathi
is when
ndo wakajua
chronic kidney disease. And Dr. Joyce, again, based on what Rodney is saying in terms of the symptoms, it's very easy to just assume that maybe this is something else and not really think about, you know, chronic kidney disease.
Absolutely. Unfortunately, very many people get treated for other things, heartburn, ulcers, malaria, brucellosis, as he said, for a long period of time before they actually, you know, get the diagnosis right. Yes, so So the sad thing about chronic kidney disease is that you can be fine. There's some people who tell us they had absolutely no symptoms until the day they came to you and they're like, I had a headache, so I decided to come, or I just noticed my urine has gone down,
color,
or
yeah.
my legs are swelling a little bit, so I came to see. And when you do your first test, you find that the kidney function is quite low.
Yeah.
It's very easy to miss it. People who have risk factors, for example, if you have diabetes, you've had it for a long period of time, and maybe you are not taking your medications well. Hypertension, especially if it's not very well controlled. Yeah, if you're obese, you have a family history of kidney disease, you should essentially get an initiative to go and check simple things. Blood pressure, when you're having your blood pressure, if it's elevated, check your urine. There are a few pointers in the urine that will say, oh, there's something that's off. There's a bit of protein here, there's a bit of blood here, and even your kidney function. So a high index of suspicion is very important, because the earlier you get the diagnosis of CKD, you can actually, the better, you can actually halt it, you can reverse it, you know, the first couple of stages. But when we get to stage 4, 5, it's more of conservative management and then planning the way forward.
Again, Rodney, listening to what Dr. Joyce is saying in terms of the risk factors or maybe causes, yako unaweza sema, like, were you ever told nini ilisababisha?
Ilianza yenyewe, vile vile sasa ndo nikajua kweli niko na ugonjwa wa kidney. Yeah.
Okay. Yeah. And then, so Dr. Joyce, a lot of patients, like you said earlier on, it's very easy to miss.
Yes.
So at what stage do you mostly see patients coming to you?
By the time patients have end-stage kidney disease, which is stage 5, only 20% thereabout have ever seen a nephrologist during that period of time, by the time they're being told they need to start dialysis. So the thing is that when they're coming for their normal checkups in the medical outpatient clinics, now we have increased the awareness amongst our fellow doctors, and we tell them, if you notice the kidney function is looking like this, alert us, or, you know, do a referral to a nephrologist. There's some things that we can do. There's some information we can do. For example, Rodney says when he was feeling unwell, he was taking a lot of painkillers. These painkillers are major contributors to chronic kidney disease. That's why the theme for this year is to bridge the gap, especially on patient education and awareness. We want people to know there's certain things if you notice, and if you have certain risk factors, please take your personal initiative to go and get checked.
Yes. So then what do the stages look like?
So the kidney works by filtering waste products and getting rid of excess water, amongst other things. So there are key parameters that we measure. Urea and creatinine. The filtration rate is 90, let's 90 to 100, give it like a percentage in school. That's stage 1. And most people are stage 1 and they're comfortable, they're okay, there's no problem. But as you progress and go downwards, you start keeping more waste in the body and filtering less. Yes, so there's that. So the first stage is that above 90, and then there's 60 to 89, that's stage 2, and so on and so forth. So by the time you're at stage 5, that's below 15. So you're only filtering out 15 ml per minute of what you're supposed to filter out. So that means you have a lot of waste products in your body. The kidney just doesn't filter out waste products. It activates vitamin D. You know how you get your vitamin D from the sun and the food? For it to work, it has to be activated in the kidney. It produces a very vital hormone called erythropoietin, which helps your red blood cells to mature. So if you're not forming red blood cells, you'll be tired. You'll be very tired. You'll have headaches. Yeah.
Okay, Rodney, so we'll talk to you as far as, fine, so you're told that you have chronic kidney disease. What next in terms of treatment? And of course, Dr. Joyce will also take us through the whole aspect of treatment process, because most of the time when you hear kidney, problem with the kidney, the first thing that comes to mind is kidney transplant. So is that the only intervention that is there? And of course, all that is coming up after this short break. Stay with us. All right, welcome back. Glad you're still with us. This is Health Diary, and today it's all about chronic kidney disease. And just recently, the world marked World Kidney Day, and of course, the theme, it's all about bridging the knowledge gap and just making sure that everybody has awareness as far as the kidney functions, and what you need to do to make sure that at least get some of these signs and symptoms early enough and just understand the whole functioning of the kidney. And to help us with the discussion, we have Dr. Joyce Bombengi, who is a nephrologist, and we also have Rodney Ofula, who is a kidney patient, and of course just telling us his story and his experience as far as chronic kidney disease is concerned. So Rodney, umeenda hospitali ukaambiwa uko na shida ya figo. What was the first thing that came to your mind? Daktari amekwambia sasa wewe.
Sasa hapo nilikuwa na changamoto mingi. Ya kwanza nilijua I'm going to die. Naenda kukufa. But kuwa na ugonjwa ya kidney sio ndo mwisho wa maisha. Unaweza kuwa na ugonjwa wa figo na utibiwe before transplant. Unaweza endelea na dialysis, ile inaitwa dialysis, tunaenda kwa wiki mara 2 na unapona na unaendelea na kazi. Unaenda na itimizi ya daktari. Kama vile chakula, tunabadilishiwa chakula, unaambiwa sasa usile hii, ule hii, unanipata. Sasa kama ulikuwa unakunywa soda, usinywe soda, kunywa maji. Tena maji yenyewe tena usikunywe sana. Unaweza kunywa kama 500 ml per day. Oh, wow. Juu tena ukijaza maji, tena ukunywe chai, kifua inajaa, na hiyo tunaenda kufanywa nini? Kutolewa maji na kuoshwa damu. Okay. So hizo vitu zote unafaa unaangalia vizuri na unakuwa sawa. Yeah.
Sasa wewe chakula kama gani, kwa sababu umesema kuna chakula?
Chakula sasa yenye unafaa ule. Example, acha tuanze na chakula unafaa ule. Unafaa ule kuku, unafaa ule fish, mayai iwe ile boil. Then mboga yenye tunafaa tule sana is a cabbage. Then cabbage you boil. Hizo vitu zote you need to do what? Boil first. Okay. Uwezi enda tu unanunua nyama, unaosha, unatupa hapo kwa sufuria, deep fry namna no. Itakudhuru bado. Alafu vitu zote tufai kula ni underground food. Inaitwa kwa Kiswahili hizo vitu za chini. Hizo example, nduma, hiyo inaitwa nini? Sweet potatoes, mogo, cassavas. Yes. Underground hizo food atufai kula.
Okay.
Yeah.
All right, Dr. Joyce, why is this?
So some of the things that the kidney does is to balance electrolytes, potassium, sodium, and calcium, phosphate, things like that, so that you have normal balance of all these things in your body. When you have chronic kidney disease, you're not able to filter out that excess potassium as a person with normal kidney function would. So those vegetables that are underground, the tubers, they have high potassium. So most of the time when you take a high potassium diet and you're not removing it in your urine, and you have to wait every 2 to 3 days to have hemodialysis, guess what will happen? And the potassium is high, it causes problems in the rhythms of the heart. So you can get a heart attack, you can get abnormal movements in the heart. Yeah, it's dangerous. The thing about chronic kidney disease is that multiple people have to come in to assist the patient.
But Ronnie talks about dialysis, and probably someone is watching us and don't really understand what hemodialysis is all about. So just paint a picture for us. Yeah.
So when somebody gets to stage 5 chronic kidney disease, there are 4 possible ways of managing the patient. So we usually have a discussion with the patient and we tell them these are the options. So the first option is full conservative management, meaning that we are not going to do any form of dialysis or transplant. There are some patients who tell you right from the start, I'm not comfortable with that. I'd rather take some medication. So we have medication that slows down the progression of chronic kidney disease and substitutes the functions of the kidney. Then there is hemodialysis. So hemodialysis and peritoneal dialysis are the 2 types of dialysis. And basically what happens with hemodialysis is that we connect a tube either to your neck, to the major vessels, to the neck or the leg, or we attach an artery and a vein in your arm. Most of the time it's the arm, so that we can take out blood, put it in an artificial kidney, which now filters out the waste, gets rid of the excess fluid, and then puts the blood back into the body. Yes, and then for peritoneal dialysis, the peritoneum is a layer within the abdomen. Okay. So inside your tummy right now.
Oh, inside.
Yes.
Okay.
Yes, you have your skin and you have your muscles.
Yes.
In between your organs and your muscle, there's a layer called the peritoneum. So you can literally put in peritoneal fluid. Yes. So that fluid is infused into the abdomen. So it's good fluid. So all the excess things that are not supposed to be in the body, they come and enter this fluid, and all the good things that are required from the body are taken out of this fluid into the body. Then after a period of time, it has taken out most of the waste. Through the same tube, it is released out.
Okay. I see it. So for you, Rodney, are you mostly on dialysis, peritoneal dialysis? That is what it's called?
Peritoneal?
Yeah.
Or what happens?
He's on hemodialysis.
Oh, yours is just hemodialysis.
Yeah.
So Nenda, how many days in a week?
2 times.
2 times.
Wednesday and Saturday.
Okay.
Yeah.
All right. Why is it important for someone to go, or is it maybe curated according to the patient's needs? Or is it standard that you have to go 2 days in a week for dialysis?
You can prescribe it in different ways. You tailor it according to the patient, what other conditions they have. But what is available to us right now is 2 sessions of hemodialysis in a week.
Okay. Yeah. So 2 sessions in a week. Again, but of course, someone might ask about the cost. So where unalipa out of pocket? How do you manage to,
I have NHIF. NHIF ndio inanisaidia. Ilikuwa inatusaidia hata mpaka vile enzi ya madawa. But sasa wakatoa madawa. We need now to buy madawa kwa mfuko zetu.
Dr. Joyce, so dialysis, again, very quickly, how long can one stay on dialysis as you wait transplant? Or is transplant like the final thing? Can someone just stay on dialysis?
Normally, we want our patients to have hemodialysis as a transition to transplant, because transplant gives them a better quality of life. Yes, only with medication. Yes. True. The only problem is that when you've been on dialysis for many years, there are other problems that start coming up. When the heart is strained, it's very easy to get a heart attack, amongst other things. Yeah, bone problems with the bones, yeah.
So Rodney, when it comes to, again, to cover, because like you said earlier on, transplant, yes, utafanywa transplant. But then again, when it comes to medication, hapo ndio kidogo kuna shida. So what would you tell, let's say the government, NHIF, hata insurance providers?
NHIF irudishe kutibiwa na irudishe tena kuweza kufanya nini? Kuchukua madawa. Yeah. Alafu, kwa sababu hata ukifanya transplant, na wajarudisha NHIF kwa madawa, itakushinda. Mfuko yako itaisha.
And Dr. Joyce, in terms of then, just recently we celebrated World Kidney Day, right? What are some of the things that you want to see done or achieved, really, as far as chronic kidney disease is concerned in the country?
I mean, as the nephrology fraternity, there's some of the things that we're very keen about. We want to increase patient education and even just the public education on what is chronic kidney disease, and that they should get screened on good time, because it's a silent disease. We do not want patients to come just at the point where they require dialysis or transplantation. The other thing is that, as Rodney has very well said, he's looking forward to a transplantation. So there are many patients and very few organs. So there's sometimes that you will find a patient will need a kidney transplant, but everyone in the family is probably exposed to the same genetic problem that caused their kidney problem, or they have hypertension or diabetes, so they're not good donors. We look forward to the operationalization of the Health Act, the 2017 Health Act, which will allow us to have a bigger pool of donors, so that, there are patients who actually have like road traffic accidents that were very healthy, and then, they pass on with healthy organs. There are people who can actually help other people live a better life, get a second chance to live a life without, the constraints of hemodialysis. So that's one thing that I'm really looking forward to.
To see happen in the country really, and help as many patients that is dealing with chronic kidney disease as possible. Very well said. Dr. Joyce Bombengi, a nephrologist, as well as Rodney Ofula, who's a kidney patient. Thank you very much, both of you, for coming by today and just helping us understand the need as to why we need to, first of all, understand the whole aspect of chronic kidney disease. And like you said earlier on, just go early screening. If you see something wrong, just go and get checked and see, what can be done. And Rodney, we wish you all the very best. And we hope that you can get the transplant as soon as possible so that, again, you can continue with life. And on that note, take a look at this health tip.
You want to do some workouts for the body toning. We have the forearm. For the forearm, now we hold it this way. Bend your knee slightly, chest out, and then you bring it from down, up, down, up. This workout will directly go to your forearm. Forearm is this part here. This is your forearm. Until you do 3 sets. First set, you go for 15 or 20. Second set, again 15 or 20. Third set, you also do 15 or 20. Now with the dumbbells, you hold them this way, and then you take them up straight. Curl them up straight. For the forearm, to go straight. Take note, all right?
What an insightful conversation we had today as far as chronic kidney disease is concerned. And just as this year's theme that was bridging the knowledge gap, it is very important for you and I to embrace checkup. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us. And just in case you have any other question in relation to today's topic, and that is on chronic kidney disease, feel free to engage with us on our social media platforms. Until next time, adios. Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, our kidney, not our body. Oh my goodness. Yeah, you'll be fine. You'll be fine.